What Ayurvedic medicines you recommend for the management of hyperthyroidism? Hyperthyroidism. We have received this query from Dr. M. Nagaraju from Telangana. Okay, Dr. Nagaraju, usually we recommend 3 medicines. 1. Bilvapatra, 2. Grit Kumari, and 3. Guduchi. And now you will like to know what is the basis. The basis is our classical texts. I mean Shastra or Aptabdesh. The scientific research that has been conducted on these 3 medicines for over 4 or 5 decades and our own clinical experience that is spread over 4 decades. Now what do the Shastras say about Bilvapatra, about Grit Kumari and Guduchi? Ultimately what we have found is the sum total of these 3 drugs that has been described in Ayurveda is ultimately their action is to suppress the hyper-functioning of Agnis, whether it is Jatra Agni or Dhatu Agnis or Bhuta Agni. That is the sum total. Okay. Now, scientific research that has been conducted on these 3 medicines over the last 4 or 5 decades also tells us that these medicines or these drugs, they somehow inhibit the functions or suppress the functions of thyroid gland. So it means if the thyroid functions are suppressed or inhibited, what will happen? Production or secretion of T3 and T4 thyroid hormones will be low. And then we have been using these 3 drugs for the treatment of hyperthyroidism for more than 30 years, and we have found this quite effective. Now the question is, how do we use this? Initially we used to use either churna powder or a quath of these medicines, but later on we shifted to extracts or ghan. So we start with 1 or 2 drugs. Usually we start with Bilvapatra ghan tablet and Grit Kumari ghan tablet. We use it for about 100 days, more than 3 months, and then we stay vigilant about the response. And if the response is fine, then it's okay. Otherwise, we add the 3rd medicine also, I mean Guduchi ghan tablet, and we continue it for months together. And as in the long run, the thyroid hormones, they start coming down, gradually we taper off the dose. So usually we have found that at least 6 months of treatment is required in most of the patients, but ultimately it could be used for 2, 3, 4 years.